Okay. I think we're live.
Are we live?
Yeah. Okay. Yeah, you're good.
Hello, everybody. Welcome to Fertility Fact or Fiction, our weekly show where we bring to you the latest and greatest in infertility, talk about sometimes scientific articles and review them, and we are often answering questions. I do not have an article for you tonight because there was nothing interesting out this week really that caught my attention. However, we do want to spend some time talking about our first ever and now syndicated D.I.C Award, the Dumb Infertility Comment Award. So we'll give everybody a chance to jump on and fill in with fluff in the meantime.
Love the D.I.C Award post.
Love the D.I.C Award post. Yeah, the D.I.C Award was pretty good. Huge kudos to my dear friend Tarek Ibrahim, who did show his face for the first time ever. Yeah.
Snuck in,
snuck out. You know, and the first edition of the video, I don't know if you caught that, the one you sent me, like the first copy. Mm-hmm. It wasn't you in the picture. I was like, who's this guy? I think it was Adam.
You know, it was so funny because I noticed that. I'm like, who's that? He's like, well, you said you don't want your picture up there. I said, well, you can't put a random. I'm like, who's that guy? He's like, well, we took your picture and just edited it on AI to make a lookalike because I know you don't want to be on there. I'm like,
that was not a lookalike, man.
I don't know who that is. I don't know who that is.
So Tarek did all the editing on that. So if you need anything done, social media, next level editing, it was a phenomenal job that he did. Very, very funny. I love that. And so a huge number of applause, love, likes for Tarek for coming up with the D.I.C Award video. And we did that in one take, didn't we? I think the magic was just there.
There is a certain vibe in this room when two bright minds get together. You can't help but.
It was awesome. We did that in one take, and then Tarek did all the editing. I'm sure it took countless hours to do that. So huge kudos to him for that. It's all in good fun, but we do want to point out scientific nonsense when we see it because we do see it out there. We have two huge dicks coming that didn't come out right. We have two huge D.I.C Award nominees and winners coming your way, and those will be ready for you guys.
Dumb infertility comment.
Yeah,
absolutely.
They're D.I.C Awards.
Yes,
and also Tarek would like to run you through. Do you have the screen share on your screen?
Give me a second. And I go.
Yeah, he's going to run you through how to nominate a post or a thread or a YouTube video or an Instagram post or TikTok or whatever that deserves a Dumb Infertility Comment Award. So we will happily take those into account. And it's now on our website. So if you want one nominated, you got to go to our website, find the tab, and Tarek's going to show you right now.
Yeah, so very easily, we did that on purpose.
Yeah.
We want everyone to do this.
And for the TikTokers, should I just show them on this?
Yeah. That's good. Okay. That way no one feels left out.
Yeah. So TikTok, go up here to the menu. Oops. Oh, that didn't work at all, did it? No. Nope.
Yeah. It's on the menu right at the top. So you got your infertility, your international clients resources, blog financing, and then you got your D.I.C award.
Yeah, you got your D.I.C award. So right there at the bottom, click on the D.I.C award.
Scroll down. And very easily put your name so we can give you a shout out, your email address so we can reach out to you if you have any questions, the handle of the award winner.
Yeah, so we need that.
Give us the actual reference because we need to make sure we're not just slinging dirt at people that don't deserve it. So give us that, and then of course the final box there is why you believe this person deserves it. Yeah, because I'm quite sure there's going to be a lot of nomination of this. Yeah, I mean, I'm pretty sure. We're going to be swimming in them. So to avoid all the problems, this is the procedure that we're deciding to go through. And of course, we're still tweaking it out. Yeah. Right? So there's still going to be improvements to the show, whatever.
Yeah, and if you have suggestions, let us know. We're open to those for sure. But definitely, if you have good stuff that you want us to review, let us know. We have one coming up where we cannot mention the name of the individual, and we're generally going to skew away from mentioning names, but We can't even post who it is because I know that individual will come after me with vengeance. But we are in the process of editing that one now. And then we just created another one for you from someone that has 1 million people, right? 1 million people following her, who said something just absolutely insane.
Garbage, complete garbage.
Yeah, so that's coming your way probably in another month or so. So we'll have that all ready to go, and we'll be able to bring that to your attention. Thank you so much for joining us. If you haven't sat down with us before, I am your host for Fertility Factor Fiction, Dr. Rahi Victory. And to my left and off camera is Tarek Ibrahim from Ibrahim Strategies Group, although he does like to be called Dr. T. And tonight we don't have a specific topic other than to review the Dick Awards. We were talking about this earlier, and the amount of inappropriate innuendo was huge because we kept talking about like how huge the Dick Awards are going to be.
That's what we said.
Yeah, it was.
It's huge.
Yeah. So we have some great ideas coming up, and also Instagram invited me, and I'm sure millions of others, to do a get to know you segment. So we're going to have some cool videos coming out for that too. We'll start tonight. And yeah, so this is all up and coming. And thank you again for joining us. So if you have questions about your fertility, whether you're male, female, same sex, heterosexual, doesn't matter. Whoever you are out there, if you have questions and you want to know anything about either gynecology, fertility, even obstetrics, happy to do my best to answer. Fire away with your questions and we will happily go through them all. And definitely, if you have any nominees for the Dick Award, let us know. I can probably even search some of them while we're on the show. Fire away.
Can Lexapro SSRI cause bad sperm perimeters?
Yeah, so very interesting question. Yesterday, my nurse practitioner came to me, or one of my nurses was my nurse practitioner, and said someone asked about whether or not a specific SSRI could actually cause problems with sperm performance. And I had not heard that before. So I said, I'm not aware, but let's look it up. And sure enough, when I looked it up, it had a huge increase in sperm DNA fragmentation and a reduction in sperm count. So interestingly, there does appear to be some data that suggests that if you are on various SSRIs, there can be an impact. How that's modulated, I don't know. I don't think anyone's figured that out. But there is some impact on your sperm quality and performance if you are on certain antidepressants. I haven't seen any other data, and I did not have time to look it all up myself. I just quickly kind of checked it in my phone. But there does appear to be a relationship between sperm performance and the use of certain antidepressants. So be cautious. Maybe look up the data. Maybe that would be a bigger video. It's
Absolutely.
a good for tomorrow. Jesus, man, I can't do this every night.
Yeah.
All right. I'll check on PubMed and I'll see what I can find while we're mid-show. Go for it.
Hello,
What's
Dr.
next?
V. My wife has had 3 failed FETs.
Oh, I'm sorry. That's terrible. Okay.
All non-PGT tested.
Yeah.
Went to a different doctor for a second opinion.
Yeah.
She recommends us getting an FET from Dr. Kilman over at Yale Endometrial Function Test. We are going to do it. What are your thoughts on the EFT test for unexplained RIF?
Yeah, I don't believe in it. Endometrial function test, the Receptiva DX, the ERA test, all of that stuff, none of them have actually demonstrated that there's an improvement in outcome. So I'm not a believer in doing any of those tests, in particular the ERA test, which is useless and actually reduces your chances of success. So we're not a big believer in that. If you want to figure out what's wrong, microbiome testing, very reasonable, lots of data shows that it's very important. Doing immunological testing, hugely important. Finding out what the quality of your embryo is, looking for things like endo, adeno, detailed ultrasounds, MRI sometimes, tests for endometriosis, including surgical testing. A very, very careful evaluation of your uterine shape. All of these things are hugely important and can very significantly alter your outcomes. But what's not going to help? An ERA test. What's not going to help? The EFT or your Receptiva DX. They just don't tell you anything useful, and they're not reliable enough to be able to tell you whether you're positive or not. I just had a patient tell me that she did Receptiva DX twice. On one test, it was strongly positive, and then she didn't do anything and did it again, and it was negative. Like, you can't, that's not a reliable test, guys. So don't do things like EFTs, don't go all the way to Yale. You can get all this stuff done from your home community. You can order testing from a variety of different centers. We use Fertility. I don't care who you use, but you can get good opinion from a qualified reproductive endocrinologist or reproductive immunologist or someone that specializes in advanced IVF cases. Myself, my good friend Fred Zaneku in Toronto, awesome fertility specialist, several others across the country and across North America who can actually help you and will figure things out for you.
Awesome job with the Dick Award. Love it.
Yeah, I love the Dick Award was hilarious.
Hello, Dr. V and Dr. T.
I was just about to say it was good.
Yeah. It was a good time?
No, I was going to use the title. We got to be so careful about what we say moving forward. Oh, God. We're going to get in a lot of trouble with this one, are we?
Dumb infertility comments.
Dumb infertility comments. That's right. Yeah.
Hello, Dr. V and Dr. T.
Dr. T.
This is
there you
how
go.
we start a great day.
You love that, don't you? I know.
Great video with the Dick Awards.
Yeah.
Amazing production. Very entertaining. Well,
Cool, eh?
That is Dr. Victory for sure.
That's you, man. You put the video together. It was very, very funny.
All right. Real question.
Yeah.
TH1, TH2.
Okay.
Intracellular ratio came back normal. Multiple miscarriage. What's the next steps?
Well, there's way more than just that, right? So your genetics, your partner's genetics, your body mass index, your habits, the shape of your uterus, his habits, sperm quality, DNA fragmentation testing, microbiome, immunological assessment, thrombophilia screen, hormones, vitamin levels, antibody checking. And every day we find 10 new ones, like things like immunoglobulins, which may now also play a role. So there are lots and lots of things to look at. Just looking at TH1, TH2 is not enough. That's a very, very cursory kind of, surface level evaluation. So I'm looking up SSRIs in sperm, and there are studies. The main one was on paroxetine, which I think is Paxil. Don't quote me on that. I'm not an expert on this stuff. But yeah, it does look like it. Then there's other studies that say no, SSRI use is not associated with impaired sperm parameters. So who knows? It's hard to tell. There's one study that says it is, other studies that say it isn't. Yeah.
What dose of sirolimus or tacrolimus, testosterone, and HGH do you prescribe for egg quality? When do you start them before egg retrieval?
So the doses we use for sirolimus, tacrolimus, you can use anywhere from 2 to 4 milligrams a day. For testosterone, it's 12.5 because we're just using androgel. And for human growth hormone, we use 2.5. When do we start them? You're supposed to start the tacrolimus 3 months before if it's for the IVF. We start it 5 days before or a week before if it's for a frozen embryo transfer. For testosterone, 2 weeks before your IVF stimulation, human growth hormone, the same. There are studies looking at different timelines. We don't give it for much longer because it does have side effects, and the cost is very high for human growth hormone. We have a weaning protocol, so if you need more info, just reach out to us and jump on a consult with us and we'll help you out.
Hello, what are the best treatment options for endo?
Oh, no one's ever asked us that before. That's a great question. Best treatment options for endo? Easy. The best treatment options for endo would include things like having surgery, which would be fantastic. There are medications you can use, Visan, Lupron, Letrozole, Orilissa, Myfembry, many different options for treatment, even birth control pill. We have the option of using things like surgical approaches, laparoscopy or open surgery if needed. And then there are natural things. So there are supplements that can help things such as NAC, curcumin, resveratrol, alpha-lipoic acid, berberine, did I say curcumin, coenzyme Q10, all of those things are beneficial.
Do you recommend immune testing before an FET for someone with Hashimoto's? I've never been pregnant.
Not automatically. It would depend on how many embryos you had and how many you were willing to risk, and whether or not you think that testing is justified. Just purely based on Hashimoto's, no, because we have lots of Hashimoto's patients. We get pregnant without having to do immune testing. But if you only have 1 or 2 embryos, I mean, regardless of what your conditions are, it's often worth doing extra testing to make sure you've dotted every I and crossed every T.
AMH was 3.91 nanograms per mil on
good.
birth control.
Yeah.
Stopped birth control and remeasured 3 months later, and it was 2.78 nanograms per mil.
That's just lab error.
Is this normal? What might cause such a large decrease?
That's probably just lab error, and I wouldn't trust that at all. So there are variations in tests and test performance for AMH. There's actually publications on that showing that different labs get wildly different results, and different testing times can give you different results. Theoretically, your AMH should be lower while you're on the pill, not higher. So I wouldn't trust the results from that.
Hey, Dr. B, for your patients that you induce non-electively at 36 weeks, how far in advance are they given their actual date of induction?
Well, we only induce patients that are at risk for stillbirth at 36 weeks. So we'll usually check you at 35 weeks and then plan it for the following week, because it's always a discussion and making sure the patient's comfortable with the plan and the hospital's comfortable with the plan and their space and who's on call and all of those things. So we're not routinely inducing people at 36. If you mean 39 weeks, which is much more common, we check your cervix at 38 weeks, which is kind of the standard, and then we decide which day you want to deliver.
7-week D.I. pregnancy.
Di. Dichorionic, diamniotic. So there's 2 sacs and 2 placentas.
Mm-hmm. Gotcha. Have 4 centimeter SCH. Anything to reduce risks?
Some people swear by using alpha-lipoic acid. There is like 1 week study that showed that it was beneficial. I haven't seen anything else. Aside from taking it easy, staying on progesterone, there's not a lot you can do. Can I just take 2 seconds? I have to thank a patient, by the way. Brittany P., thank you for the sweets today. That was lovely. I do want to say thank you for that on international show TV, whatever this is. And thank you very much for that. And again, to the wonderful, wonderful, amazing, phenomenal friends that brought us brownies. Oh my God, those brownies were good. So freaking good. Amazing. My son wolfed down like 5 in a row before my mom had to take them from him. Yeah.
Can a pregnant woman, can someone still having a chance at having a child with male with low testosterone levels?
Sure, as long as he's producing sperm, his testosterone levels aren't that relevant. Now, frequently guys who have low testosterone may not have great sperm. More importantly, if he doesn't have high enough testosterone levels, he may not have much of a sex drive. So that can interfere with your ability to produce a child, but doesn't stop it from happening. It just might reduce your chances.
Can a pregnant woman start taking melatonin when she hasn't before?
Yes, absolutely. There's no risk to melatonin in pregnancy.
Would you do anything special for FET on a patient with lichen sclerosis intralipids?
What? Lichen sclerosis has nothing to do with an FET other than that it can make it more uncomfortable. So we would be very cautious with doing it. From the standpoint of, is it causing inflammation? Yes. Should you have immunological testing? Probably, because you may have elevated natural killer cell cytokines. So if you had a diagnosis of lichen, it would be reasonable to consider doing advanced testing. Sure, it is an autoimmune condition and it's a significant one. But I'd actually be as worried about the comfort of the patient during the actual FET as I would about the success of the FET. So both of those are going to be critically important.
Can a man who freezes his sperm
Carly just asked on TikTok who really edited that video. That was T. T did that video. No exaggeration. He did that whole video. It was amazing. It was the best work he has ever done.
I think Carly might be hating. I think borderline hate coming here.
Yeah. Well, Carly.
It's okay, Carly.
T feels hurt. You want a Kleenex, bud?
No, I'll be all right.
You're okay? Yeah, I got some here.
We'll man up.
You sure?
Yeah. We're good.
You good?
But you know what? I take it as a compliment.
Yeah.
He has to be using AI. No, there's no AI there.
No AI.
No
it was
AI.
like hand done.
Hand done. Good old-fashioned way.
Yeah.
Is metformin beneficial for autoimmune diseases before FET?
Is metformin useful for autoimmune diseases before FET? I haven't seen anything in relation to that specifically. Having said that, just last week we presented on the fact that metformin was great for patients who have endo. Endo isn't quite autoimmune, but there are benefits from an immunological standpoint with metformin. So it probably is beneficial, but I'm not aware of any specific evidence. I would have to look that up for you. Carly says it's insanely good. I know, it was like the best thing we've ever done.
So
you guys all need to push it, like send it out to everybody so it goes viral.
So let's put it all in perspective.
Yeah.
It's very important.
Yeah.
Dr. Victory,
Yeah.
first and foremost, is an incredible person.
Oh, thank you.
So his
That's
ability
very
to
sweet.
convey a story,
glad. Yeah.
and just run with it,
Yeah.
very good.
But I did have good inspiration.
He definitely had good inspiration.
Yeah.
And let's be honest, that was a pretty big dick right there.
It was
Right? It needed addressing. It needed addressing.
I still don't know where the guy got that number from. Like, it makes no sense.
You know,
there's nothing about that on the entire article.
The people on my team, right? They were like, "Here's the article," right? Because there's a moment where like, "Well, here's the article." I'm like, "Okay, read it." And obviously, they are not Dr. T. So we don't know what this is. I'm like, you don't know? So we read it together.
Yeah.
As a group, we just sat down and read.
Yeah.
And they said, "Wow, this guy just made it up. There's nothing here."
There's nothing in there.
Nothing here.
I used the computer to search it. The
nothing
number
there.
30 isn't even in
There's
there.
nothing there. Yeah. Wow.
0.
Yeah. That's why I got an award.
That's why I got
That's why I got an award.
I got a big award.
We don't just give these out for no reason. Well, this isn't a joke. This guy deserved it.
Yeah, we need more fodder, so definitely send us stuff because we'll keep them coming as long as.
Absolutely.
Yeah. We even put up a green screen tonight. So
Yeah, we got some special effects for the
production.
next one. That's right. We got some special effects for next time.
Yeah.
Dr. Victory, is 35.8 mil post-wash a good number for IUI?
That's great. Anything over 9 to 14 total motile count is good.
1/8 embryos came back euploid at VRC 30F and 34M. Endo and mild.
Her age and his age.
Oh, okay.
Yeah.
What can we test additionally?
You could do immune testing, microbiome testing. Those are the only things we don't routinely do. Fertility testing would be the only other thing you could do.
Are there scenarios where you advise against PGT-A testing?
Yes. So if you have very few embryos, depending on what your next move would be, it may not be of any value to do PGT testing. If you are very young, there's no proof that it's of any benefit. So that's not a helpful situation. And arguably, if your embryos are very poor quality, it's questionable as to whether or not it's of value to do it and or whether the embryo gets damaged from already being weak and then you poke and prod it. So strong embryos have no trouble tolerating PGT, but I'm not sure the same is true for weaker embryos. So yes, there are some circumstances where my lab will actually call people and say, look, don't bother. Even if you've asked for it, they'll say, don't bother. You only have one embryo, for example. And if there's only one, to spend all that money to find out if it's normal or not, you're going to know if it was normal or not when you try and it doesn't work. It probably wasn't normal. So sometimes it's not that helpful to do.
Hi, I did 3 to 7 letrozoles at 5 milligrams. Friday, day 10,
Yeah.
I had a 22 millimeter and 15 millimeter follicles.
Yeah.
Saturday was at 19 and 16. Monday, 20 and 15. I did IUI today. Should I be worried that the follicles didn't grow?
That sounds weird, almost like maybe different ultrasonographers were measuring, so there can be a little bit of variation. So what I'm looking for as well is like your estrogen level, and is it going up, and that helps me gauge whether or not the follicles are really growing or not. So I would need to know more details, who you were seeing, what happened, all of that stuff, and look at images as well, which we do routinely.
Thoughts on estrus priming times 10 days prior to starting IVF stimulation?
So there are 2 studies on estrogen priming, both of which were randomized controlled trials, which showed absolutely no benefit whatsoever. So there is no benefit to doing estrogen priming. It is not helpful. Having said that, there are some people where they're going to benefit from it because they just can't line up their eggs to grow. And it does help you line up the eggs. Is it shown to improve the outcome? No, but remember, everybody's different. So what doesn't work for the general population doesn't necessarily mean it won't work for you. So there are some very, very, very rare circumstances where it may be beneficial, but I don't routinely use it, and I never have. It's very rare that we will do estrogen priming here.
Going through Instagram.
Yeah.
Saw a glimpse of Dr. T today when you posted the Dick Awards video. Why is he hiding behind the camera all the time? Has to be the most dynamic doctor duo there is by far.
That's nice. That's really nice. Yeah.
I think we are a good duo.
We are a very good duo. We're a good team.
I really think so.
Yeah.
Yeah. I concur with that observation. Next question.
Yeah, sure.
What is the best time in pregnancy to get a flu shot? Is there a point it becomes too late?
It's probably too late if it's right before the delivery. Having said that, remember, the flu shot is not to protect your baby, it's to protect you. Pregnant moms who get the flu in pregnancy have a higher risk of actually dying. ICU admission is higher, death is higher, pneumonias are higher, all of those things. So we're giving you the flu shot to protect the mom. It's not to protect the baby. It's not like RSV vaccine or doing the pertussis vaccine and stuff like that. This is to protect mom. It's not to protect baby as much.
Would you do anything special for an FET on a patient with light? Oh, we did that one.
Yep.
Can a man who freezes his sperm do IVF with 3% sperm per mil in each vial with 1% motility and 0% morphology? Is it worth it?
Can you? Yes. Should you? Highly questionable, especially with frozen. I mean, that is not going to result in a good outcome for sure. You're going to have compromised results. Now, could it still work? Yes. Is it going to be challenging? For sure. Is the lab going to kill me? Yes. So, I mean, I would be very hesitant, but it is possible. So it depends on how much better you can make your sperm.
Is metformin beneficial for autoimmune disease?
You asked me that one.
I did? No, that's somebody jumped a line. Can Resperidol and Lexapro cause bad sperm testing?
That was the first question. Remember the Lexapro?
Double Q.
Yes. We do think that various psychotropic medications may impact sperm quality.
Oh, yeah.
It's questionable as to, how much of an impact. And just kind of quickly scrolling through right now on PubMed, some studies are saying yes, some studies are saying no. So it's hard to know.
Is mild cramping normal in 5 weeks, 1 day spotting, but think the progesterone went in too far? Nothing since cramping mild and intermittent since week 4. Last HCG 2554 at 4 weeks, 5 days.
Cramping can be from a million different things: stretching of the uterus, ectopic pregnancy, bladder infection, fibroids, all sorts of different things, miscarriage. So no cramping is necessarily normal. We'd prefer you not be cramping. But not all cramping is necessarily pathological, meaning it's going to lead to something terrible either. So I would always recommend you go get checked out because you don't want to miss those big ticket things. But I wouldn't panic about going to get checked out, but I would go to get checked out. And remember, we're on a internationally broadcast show. I have to tell you to go get checked out. So if you come in and see me in the office, I might say, don't worry, it's fine. But without seeing you and without you being my patient, I have to tell you to go get checked out, because otherwise if something happens, it's my responsibility that I didn't tell you to do that. So yes, if you're cramping, especially if you're spotting, I would take that seriously. You would want blood work, ultrasound, make sure things are going normally.
Hi.
Yeah.
I did day 3-7 letrozole at 5 milligrams.
Okay.
Friday, day 10, I had a 22 millimeter and 50
We did that one. You just read that one.
Approximately how long after the cycle day 21 injection does an FET usually happen?
About 3.5 weeks, generally speaking, somewhere in that vicinity.
Treatments for high candida on fertiliosis.
Fluconazole once a week for 4 weeks is what we do for our patients. Make sure you're on a low sugar diet.
Thoughts on embolization for varicocele vein?
Okay, so I have an opinion on this. So embolization is often involving something called polyvinyl alcohol. And polyvinyl alcohol are these little tiny spheres that conglomerate and join together to plug up the blood vessels. So when we end up with those in an embolization of a varicocele, it can actually travel past where you're plugging it and embed in various parts of the testicle. So when you ultrasound these people, that you can see all these little spots in their testicle. Intuitively, to me, it doesn't make sense that your testicle will be full of polyvinyl alcohol particles. So I don't love it. I'm a much bigger fan of doing mechanical surgical tie-offs for varicoceles, but a lot of people are not doing that anymore. They're moving more towards the embolization because it's easier. So I'm not a huge fan of the embolizations. I'd much rather have the surgical approach, but the radiologists and even some of the urologists swear by doing the embolization.
Do SSRIs affect female fertility, particularly follicle number or quality of stimulation cycles?
Only if your prolactin levels go up as a result of use. Typically, otherwise, no. However, there are fetal effects, including lung and heart defects, which are possible. So where unnecessary, we tell people to stop using them. But when it's necessary, you have to prioritize your mental health.
Doing natural FET, no meds, natural ovulation, 12 millimeter lining, doing PIO every day with subs on days between, is this overkill? Abdomen feels crampy and only 3 days in. Do you recommend intralipids or anything else for patients with lichen sclerosis?
Lichen sclerosis. We don't do intralipids typically for lichen, but there's no harm in doing so. I don't do intermittent progesterones. We just do it every day. So I would use a combination of your PIO and your vaginal daily. That's all I can tell you for us. You have to decide what's right for you, of course, but that's what we do for our patients. Charles has a quick question. She had an anterior placenta and she wants to know about what to do, or she wants to know when she's going to feel the baby move. It's normal not to feel the baby move till around 24 weeks. After that, you should be feeling the baby move. So you might feel it sooner. You also might not, so don't panic.
As you are preparing for a transfer, is there a lubricant you'd recommend? Example, pre-seed. My cousin recommended olive oil.
Yeah, you can use oils or pre-seed or even a water-based like KY. So any of those would be fine. I'd probably avoid the silicones, but anything else would be fine. Don't use saliva.
Do you recommend intralipids or anything else? Oh, did that? Hello.
That person's like aggressive, like they want their answer.
You got it. You got it. Letrozole 2.5 started my period. Does this mean that I have to wait another week for a trigger shot?
What? Letrozole 2.5
started my period.
Letrozole doesn't start periods.
I think it just started. This is beyond.
I don't get that question.
Oh, see, that's the two of us. See, I am a doctor. Dr. T. Whoa. Nope. Wasn't ready for that question. Wow. well, this is for you for sure at this point. Escitalopram, escitalopram, okay to take in the months leading up to FET and hopefully pregnancy, or would it best be to try to wean before transfer? If it's best to wean, how many months before transfer?
You should always be off of SSRIs, SNRIs, as far in advance as possible, as long as your mental health is controlled. So this is not something you do on your own. You only do it in discussion with your doctor. But if you can avoid being on psychotropic medications prior to pregnancy, you should. Now, again, this is purely based on not wanting anything bad to happen to the fetus in terms of structural abnormalities, teratology. But I need you to 100% understand you should not do this on your own, because you cannot jeopardize your mental health. That's super, super important. Holy cow, someone's asking the same question 5 times.
Would you ever recommend 81 milligrams aspirin times 2 over injectable blood thinners?
No, they're not the same. You can't compare 162 milligrams of aspirin to a blood thinner. It doesn't work the same way. 2 different
How do I
actions.
make my period come naturally 9 months postpartum?
Birth control pill, Provera for 10 days. Naturally? I don't know how you would do it naturally. There's no natural way to make a period come. Maybe see an acupuncturist, naturopath. You're going to have to take some kind of hormonal.
So the period doesn't come? Well,
it should, but if she wants it to come
now,
and it hasn't yet, and she wants it to happen naturally, there's no natural way to make your period come.
Yeah, natural. You gotta wait.
Yeah, you gotta wait.
That's the natural way to do it.
Anything else wouldn't be natural.
Yeah, that's it. Is it risky to take estrogen if you might be estrogen positive surrogate?
I don't know what you mean by estrogen positive surrogate.
Maybe in brackets she's a surrogate?
Yeah, but I don't know what you mean by estrogen positive. If you mean you're estrogen dominant, that doesn't exist. It's nonsense created by people that want to market stuff to innocent victims of scams. There's no such thing as progesterone dominant or estrogen dominant. That's nonsense. People have conditions, PCOS. You have high levels of estrogen. You're not estrogen dominant. You just have high levels of estrogen because of a physical condition that leads to you producing high levels of estrogen.
Only one euploid for the FET. Thoughts on CPP with natural protocol and or endometrial scratch sono on Friday?
If I only had one euploid embryo, I'd be doing fertility testing. That's just me. I would do everything I could to make sure that one embryo is going to stick. Endometrial scratch is proven pretty much to be useless, so I definitely would not be doing that. I haven't done one in a decade, maybe longer. I have to just answer this one girl because she's asked 15 times on TikTok. Sumanism. I applaud your tenaciousness. There's no difference between prednisone and medrol for an FET endo protocol, please. So use either one. You can use prednisone. We use prednisone, but you can easily use medrol. There's no difference. Chels goes, girly, just wait. He'll answer you.
We will. We will answer.
Thank you, Chels. I love the fact that we have some defenders of our program.
That's it.
Chels is a pretty good defender.
Special guest referee. That's what we call this.
Special guest referee. That's good, yeah.
Goodness, if I were a medical provider who used social media, I'd be so scared of ending up on a dick episode.
I hope so, yeah. Maybe it'll encourage people.
We're trying to help.
We are trying to help.
Ultimately, that is the goal here, is to improve everyone's fertility journey.
Yeah. I had a couple from St. Louis, Missouri with me on a Zoom today, right? So we get people requesting consults from all over the world, and these guys were from St. Louis. And once again, and I don't get this, right? So their doctor put them on Lupron. Okay, I guess they thought they had endo or something. I get it. I'm a big fan of Lupron. Great. Lupron. No letrozole. Okay, not great, because it doesn't work unless you add in the letrozole. So I was like, and then she goes, but they put me on birth control pill to stop the symptoms from the Lupron, and I was like, birth control pill is not appropriate add-back therapy when you're on Lupron because it's like 10 times the required dose. So you're on like high levels of estrogen if you're on the pill, which negates the whole purpose of taking the Lupron. And then she said they put her on an estrogen protocol for her FET. So the clearest analogy I can think of for this is you need the lights to be off. Whatever, you got a migraine, you got a splitting headache, whatever, right? So you need the lights to be off. So what do? You turn off the light switch. That's Lupron and letrozole, okay? So then you decide you're going to go on the birth control pill, not the patient, the doctor says this. So they're like cranking up the dimmer switch. But then you get to the point where your headache is pounding, and it's the most important part because your headache is like at, oh my God, amputate my head, I'm going to die level. And they actually turn on stadium lights in your bedroom because that's what estrogen is for someone with endo if they're trying to keep the lights off. It just makes absolutely zero sense. So, I mean, if you're going to do stuff like that, yes, I'm going to give you a dick award. It doesn't make it makes zero biological sense. Zero. None. It makes no sense to put someone on an estrogen protocol if they have endometriosis. It's like the opposite of what should be happening. So, yeah, those guys are going to...
They're
going to get dicked.
There you go. That is what we're doing here. That is what we're doing here.
There's so many wrong things we can say from this.
I'm telling you, people are going to second think their recommendations to their patients.
I hope so.
We are indirectly fixing the world, at least the fertility world.
Okay, wait, I gotta answer these two. After first miscarriage, when can we try again? As soon as you get your period. Have I ever heard of ROSI for men with azoospermia? Have you ever worked with embryos made from ROSI? I don't know what ROSI is. I've never heard of that acronym before. Let me know what ROSI is. I will be happy to address that. Rima, did you have your baby? You couldn't have had your baby. It's too early. Rima, tell me if you had your baby. Just say yes or no.
It's hard to check your phone right now.
Yeah. Rima's like a huge win for me.
Oh, okay.
She worked with another clinic, and we helped her out. So,
wonderful.
Yeah. I was just thinking about Rima, actually. Yeah, go ahead.
For people with low AMH and ovarian reserve, why not freeze at day 3 or port in fresh day 3?
So, the best studies we have right now show that day 5 is better than day 3. So we try not to do day 3s very much. There's nothing wrong with it. And if someone requests it, no problem. But we, generally speaking, try to avoid it. The studies show day 5 is better. So generally speaking, that's what we do. Rima had her baby. Rima, congratulations. Huge love for you, Rima, and your husband. You guys are lovely, lovely people. Thank you for choosing us to help you out. We love you, and I am so happy for you. That's awesome. That's absolutely amazing. Okay, so round spermatid injection. That's what ROSI is. Yeah. So the success rates with anything shy of a elongated spermatid is very, very poor. You're generally speaking looking at about a 10% chance it's going to work out to be a normal baby. So it's not good, but it can be done. Yeah, it can be done. You are welcome, Sumanism. Number 1 fan from Alberta. Can Ozempic help with PCOS symptoms? How? Yes, Ozempic can help with PCOS. So it will sensitize you to your insulin. It will drive your insulin levels down, and it will definitely make you lose weight, all of which is important if you're in the I struggle with my weight PCOS category. So it can be very, very helpful. Yeah.
Hi, docs. 38 years old, did first conventional IVF. I'm just, at this point, taking these. You know what I mean? I feel by just acknowledging it as fact, then it's a fact.
Yeah.
I'll repeat the question. Hi, docs, 38 years old.
Yeah.
Did first conventional IVF with estrogen priming.
Okay.
Ended up with 2 euploid. Should I consider ICSI this time? Is there anything else I should consider in my next IVF cycle?
I mean, I would need to know way more about you to answer something like that. You know, how many eggs did you make? How many fertilized? How many didn't fertilize? What's your partner's sperm like? Like, there's a lot that goes into it. How long did you stim for? What dose did they give you? So I can't really answer something like that. I mean, things we use for people that didn't do well before, antioxidant media, Neupogen media, we always double trigger, flushing. We ICSI everybody because our success rates are much better with the ICSI. So, I mean, there is quite a bit of stuff that can be done with the, protocol to improve your chances, but it very much depends on what they did for you already. So I'd have to figure that out.
How can you track natural with PCOS? I want to sync that up with the trigger shot.
What natural what?
How can you track
Oh,
natural with PCOS?
how can you track natural?
I want to sync that up with the trigger shot.
How can you naturally track when to trigger it? You can't. You need an ultrasound. There's no way to naturally track.
Hey, Dr. Victory, I just started my priming medication today.
Okay.
Now, does caffeine affect the outcome of your IVF cycle or affect the quality of eggs or ovaries? Should I not be drinking caffeine?
1 cup a day is fine. Don't have more than that. It won't affect anything as long as it's less than 1 cup.
Did you see that? Did that show up on your screen too?
What?
You got some like giant. You didn't see that?
No.
Oh yeah, you got a gift. On
I got a sub fiesta.
Yeah, you got something.
Do you want me to answer some of these? Thoughts on HCG? I'm missing some.
Don't answer anything. No.
All right. You're going to do it?
Play the...
All right.
Let me bring them to you. Don't worry.
Okay.
Don't worry. There's so many.
Yeah.
Dear Dr. V.
Yeah. No, Dr. T. I know you're upset.
Yeah.
Yeah.
Questioning if I should continue. Reading the question. My OB recommended Gynaflor combo of probiotics and estrogen.
Yeah.
Will this alter date of onset of my period and egg quality as I'm doing harvest next month?
If it's got estrogen in it, it will. Yeah, of course.
Hey, Dr. V. What are missing KIRs? Can it cause pregnancy loss? Can Neupogen fix this? Can we use Neupogen for DQ alpha? I read it in Braverman's blog about this.
We don't normally use Neupogen for DQ alpha, but we do use it for KIR mismatch. For DQ alpha, you can do lit if you're a partial. If you're a full, there's not a whole lot, like subcutaneous IG, IVIG, that kind of thing.
What does CoQ10, resveratrol, and curcumin do?
They're all very good anti-inflammatories, so they reduce the inflammation caused by the endo.
Are NAC and inositol safe to take while breastfeeding? What supplements are safe for PCOS while breastfeeding if you hope to transfer again once weaned?
They're all safe. There's no risk to breastfeeding with that stuff.
Is berberine safe in pregnancy to start or prevent gestational diabetes?
I'm not aware of any evidence that suggests that berberine will prevent gestational diabetes. I actually don't use berberine, but I don't know of anything that says that it's safe or unsafe in pregnancy. I don't know. You should ask a naturopath.
Hi, doctors.
Hi, doctors. See, now you're in love again. Yeah.
We're back.
Yeah.
When do you recommend lit therapy, and how do we know if Intralipids are working?
You don't know if Intralipids are working. There's no real easy way to know unless you retest. Lit therapy, lack of antipaternal antibodies, super high NK cells, partial DQ alpha match, all of those can help with lit therapy.
So there's a lot of questions on TikTok.
Yeah.
But not enough likes.
Not
today.
enough likes?
Yeah,
Okay.
so I think if TikTokers want some answers,
You gotta
they
put
need
out
to
some
earn
likes.
some likes.
All right,
They need to
let's
share
go.
a little bit. A little bit of love.
Yeah.
What issues do you need to have for Intralipids to be beneficial?
elevated NK cells, elevated NK cytotoxicity, low T regulatory cells. Any of those things would be reasonable.
Are
Endo.
Are vaginal probiotics effective?
Yeah, of course they are. Hugely.
Hi, Dr. V&T. Is glutathione?
What?
I swear.
Glutathione?
Sure, glutathione.
Okay.
A lot of, not, they didn't teach that at the med school I went to. You know what I mean? Glutathione. There's really an absorbent lot of effort.
The med school you went.
Yeah, like that's a lot of effort for a word, to be quite honest. Who was putting these letters together?
I just want to know which med school you went to.
I don't think glutathione was part of my course curriculum. I don't know about your...
Okay, what's the question?
Glutathione. Now when I look at it, it looks pretty obvious. It was just such a hodgepodge of letters, my brain couldn't unscramble it. Anyway.
Okay, yeah.
Grade 3 grading. That's what we got here today.
I'm tearing up, man. That was good.
IV infusion are a beneficial thing to do for FET prep?
Glutathione is a very powerful anti-inflammatory, so I've never heard of it done IV, but you should ask a naturopath about that one. Yeah. Oh, look at that. What are my thoughts on how the presidential debate went?
That's a question for another day.
That's a question for another day. I will tell you, I will not ever share my political views with anybody other than Tarek, who knows them well. However, I will say this. I still want to, okay? I want to make a video showing the fact that on both sides, completely on both sides, in over 90% of the cases, they absolutely avoided answering the question, which is classic politics, right? You're asked something simple like, I don't know, whatever, how are they going to fix the border? Well, I'm the one with the experience doing this, and I'm the one with the experience doing that, and they never actually talk about specifics. Like, I'm not a politician. If someone comes to me and says, how are you going to fix my endo? I don't tell them that I'm an endo expert and that I have loads of, surgical skill and that I know how to excise it. Who cares? That's irrelevant. They want to know what I'm going to do for them. So politicians just always avoid answering the questions. And whether they're a politician or someone running for politics, that's all they do. And every single question those people were asked while they were up there, they avoided answering the question. So how did I think it went? I thought it was classic seeing people obfuscate. And if you don't know what that means, look it up, because that's all that was. It was obfuscation.
Grade 3 vocabulary.
Yeah, a little bit more than grade 3.
That's the doctor hack. Throw it out.
Yeah, that's the honors English major.
There it is.
In me. Yeah.
Difference between Medrol and prednisone for FET.
I answered that one because she asked like 14
that's
times.
The one? Yeah.
Sumanism.
Even on Instagram.
I know. She was like everywhere. Like, what's the difference? Yeah.
Can 2 back-to-back miscarriage in the early 30s truly just be bad luck, and in future I'll be able to carry to term, or am I doomed?
Well, you're definitely not doomed. Could it be something? I think I'm going to rephrase that for you. Could there be pathology present that is leading to you having miscarriages if you've had 2 in a row? Yes, and the recommendation currently is that if you've had 2 in a row, you should have an evaluation. But is it possible it was bad luck? It is definitely possible it is bad luck. And in fact, it's probably likely it was just bad luck. So you could easily say, I just want to try again, or you can see one of us and we'll do appropriate testing for you.
Starting a second round of IVF, my doc insists on estrus priming.
Insists.
Wow. On estrus priming. I have questioned this since you mentioned it isn't effective and that testosterone priming is better.
Yeah.
She said it's similar enough. Is that deserving of an award?
That deserves a Dick Award. That's a Dick Award. So
this individual, I can read their name.
She needs a big dick.
Yeah. No, not like the person. So, she absolutely does. Absolutely. Yeah. So if you want to go to our website and submit who this person is,
we're gonna get in so much trouble.
I think it's deserving.
That's deserving. Yeah, they're not the same. So testosterone is designed to increase the number of eggs that you can produce by supporting the environment in the uterus to become more full of the supplements and nutrients and IGF-1 that you need to stimulate increased egg production. Estrogen priming, which does not work and has never been proven to work, only lines up the follicles so they grow at the same rate. It's not making you make more. It's just making more of them grow together. That's all. That was too funny.
It's deserving.
It is deserving. Yeah, that is dick worthy.
Yeah, 100%.
Yeah.
So I was going to say, they go to our website.
Go to the website.
Go absolutely. Like,
nominate for
when you have a story like this.
Yeah.
It's even a debate if you come to the live. Like if you come to live, you just go straight and nominate.
Yeah.
And we will completely.
We should have like a show dick award. Like have the mic and then the little.
Oh, if you do live.
We got to get like a 3D printer. Oh, Ashley's husband can 3D print that.
That little trophy?
Yeah.
It's a good trophy.
It was a good trophy. I spent some AI time on that trophy. Yeah. They went through a lot of weird iterations before I got to that one. Yeah.
Is on TikTok, is 4,000 likes enough? My fingers hurt. We appreciate all the effort, Sarah. This is phenomenal work.
Yeah.
Difference between Medrol and prednisone for FET endo protocol, please.
We did that one.
Can a UTI trigger endometritis to return in someone with chronic endometritis?
No. Totally separate parts of the body.
Is gluten-free beneficial for autoimmune patients before pregnancy?
Maybe. Talk to a naturopath. They'll probably say yes, though. Charles has asked the same question 14 times. Can we answer that one?
Of course.
Is it normal for the RE to continue doing transfers before fixing it? I think she mentioned isthmocele right before it. Because she has many embryos. Yeah, so an isthmocele is proven now. They just proved it last month, actually, last week, to increase the number of bad bacteria leading to dysbiosis in the uterus. So I've been saying that for years, but now there's actually proof for it. So obviously that supported what we were thinking. And because of that, it'll mess up your microbiome. You can't fix the microbiome because the isthmocele traps the bad blood or menstrual blood, and that is great food for bacteria. So even if you correct it with antibiotics, it's coming right back right again. So how do you fix it? You must resect the isthmocele. Are there REs that are not doing that? Yeah, there are lots of REs that are not doing that. Why? Either they don't have surgical skills or they don't know better. I mean, there's only two options there, right? I don't do that because A, I know better, and B, I have surgical skills. Yeah, I may need to give myself a dick award for that one. But anyways, yeah.
Can Gardasil vaccine have any effects on FET?
I would not recommend anyone take any type of vaccine around the time of an FET because you are activating your immune system at a time where you want your immune system to be reasonable. You don't want it disactive or unactive, and you also don't want it overactive. You just want it normal. So I would not recommend anybody take any kind of vaccine around an FET.
Doing natural FETs, no meds, natural ovulation, 12 millimeter lining, do a PO every other day.
We did that one.
People gotta just give it time. We're coming.
We already did it too. Why do they re-ask it when we've already answered it?
How long after a rescue cerclage removal is delivery expected?
It depends. Some people don't even go into labor and we need to actually remove the cerclage. Other people, it can be like almost instantaneous. Yeah.
Hi, Dr. T and V.
And V. Yeah. Yeah.
I'm doing an FET.
I have to say, with the Dick Award video editing, you deserve a PhD just for that one. So you get a PhD in video editing for that one. If not the full
it's
MD,
a team effort.
If not the full MD, you're still getting a doctor.
It's definitely a team effort.
Yeah, that was good. It was very good.
I'm doing FET this cycle. Can you explain when I should start taking Flora SAP and when I should stop? Also, is it safe to take it the night before transfer
Yeah.
and the night of the transfer?
It's safe to take any time, so that's an easy answer. We usually start it as soon as your period is done as part of that FET cycle. So as soon as you stop having your period, start taking the floor.
Hello, I have a question. Can you become infertile after a miscarriage? It's been 2 years since my miscarriage. My cycle is normal between 30 to 32 days.
If you had retained products, if you had to have a D.I.C and there was scarring, yes, those could. So anything that could cause infection or scarring could make you infertile.
I'm a 42-year-old woman, AMH 0.7. Only one ovary is producing one dominant follicle, which HGM 75 and letrozole 2.5. Combined, other ovary is not barely visible on ultrasound. Am I menopausal?
What was the AMH? 0.7?
Yep.
You're definitely headed towards menopause. I'd need to see your hormones to tell you if you're menopausal, but that's concerning for menopause, sure. Yeah.
I'm not sure what to do with this. I don't know if this is
You
a
look
question.
very confused.
Yeah.
Wait. Can lactation affect fertility even if only nursing 2 times a day? Yes, absolutely. Your prolactin levels are high. It suppresses ovulation and estrogen and interferes with your lining. Yes. Barely. Go.
Barely. I don't know if this is a question or a comment or I don't know what this is, but I'm going to read it because I just don't know if this is a real thing.
Okay.
What does it mean when your semen is transparent?
So you probably have very little seminal proteins present and it's more fluid. That's rare, but we do see it. I'd have to see sperm performance. It could also mean that you have very low sperm count. So we'd have to see that.
There it is.
902.
902. What doses of CoQ10, resveratrol, and curcumin do you recommend? Oh, we did that, right?
No.
I swear we. Anyway, do you recommend for patients with endo?
CoQ10 600 a day unless it's Theralogics, which is 125. What was the second one? Oh no, that was the first one. CoQ10, resveratrol between 1,000 to 1,500, usually 1,200. What's the next one? Curcumin, 60 milligrams. Next one?
That was it.
Oh, all right. There you go.
For endo patients.
Yeah.
Just found out I'm positive for Ureaplasma parvum.
Oh, yeah.
My husband hasn't been tested.
Yeah.
Is it possible it has infected not only him, but that his sperm is infected?
Yes.
He has no symptoms.
He wouldn't.
Yeah.
He wouldn't have symptoms. Ureaplasma almost never causes symptoms, so you should both get treated. Even if he was negative, I would still treat you both. Are we done?
Yeah. Well, you're not, but you.
It's an endless series of questions,
Yeah.
eh? Let's do one more from TikTok. From Care Lane.
Do one from Instagram.
Okay, well, let me do this one.
Okay,
first.
do that one.
Any recommended supplements for egg quality? Loads. The basics, your prenatal vitamin, your fish oils, your vitamin D, your melatonin, your coenzyme Q10. Those are just basic ones everybody should be on. And then depending on what else you have going on, you might need iron, B12. If you have PCOS, inositol, coenzyme Q10 again, NAC, or resveratrol, ALA. If you have endo, we swap out the inositol and we put curcumin in there instead. Okay, pick a Tarek's terminal question.
Terminal question coming up, sir.
Yeah, give me a good one. A brain teaser. Something that'll make me think.
You ready?
Yeah. Also, I want to know what people think of this new jacket. I should have asked about this.
You should have asked about the
I love the jacket. It's actually like the thing is built in. It's not a scarf, although it looks like a scarf. T like the jacket. I'd love to know your thoughts. Yeah, go ahead.
This is a big one.
My sports jacket is so sharp. Someone just said that. Awesome. Yeah, go for it.
Okay, here we go.
Big one.
How many brownies
Oh,
will it take to get some insider information on your January hospital schedule at Met? I'll do induction.
1 tray of brownies. Yeah, 1 tray. I'd be good with 1 tray. Whoa, you okay?
Yeah, it was just the tea, but I finished it, so it's no fair.
All right.
Okay.
More?
Yeah, one more. I figured
Did you hear that thunder out there?
Scared the hell out of me.
We're going to get hosed when we go out there, man.
After hour comments coming out here.
Thank you, Chels. The sharpest. Oh, you're sweet.
The sharpest, absolutely.
I love her.
It's a very nice jacket.
Yeah.
People thought it was a jacket. People thought it was a scarf.
A scarf.
Yeah,
it's not
people thought it was a scarf.
I know, it's
yeah.
built into the jacket. I love it. It's very cool. Yeah.
Okay, here we go.
Yeah.
Here we go. You put so much pressure on me.
The suspense is killing everyone, man.
So much pressure to find the best.
Yeah.
Okay, guys, I'm doing my best here, okay? Imagine playing this for the doctor that told her this. Watching the doctor's face when you say she deserves a big dick. That's really what should be done.
Yeah, Dick. Dumbest infertility comment or dumb infertility comment.
Imagine. That's what a doctor said about you.
All right, guys, we're going to shut it down. Charles, I love you too. Thank you all for joining. Huge love for Tariq Ibrahim from Ibrahim Strategies Group for his spectacular video editing on our Dick Award. And please let us know if you have any good information for a Dick Award, because we have some really good ones coming, but we're looking for the craziest of the crazy. Have a great night, guys. Love you all. Be well, be safe, get good fertility care. And we will talk to you all again next week. Next week on Fertility Factor Fiction. Yes. Oh, next week, Shireen Rahal, our new doctor, will be joining us. If you are a huge fan of the show, if you want to get into Victory Reproductive Care, but you're waiting forever to see me, please sign up to see Shireen. Shireen is awesome. She's super sweet. She has the same philosophies I do. She's great with patients. She's way nicer than I could ever be. Everybody loves her, and she's a star. So please come in and see Shireen. She'll take very good care of you. Have a great night, guys. Love you all. We'll see you next week with Shireen. We're going to torture her with lots of interview questions. Oh, and we have a huge Instagram, Facebook, YouTube, and several other social media and not exactly social media platform people or person coming to join us as well on a future show. Just trying to coordinate times with her. So that'll be exciting for everyone too, but I can't announce until it's finalized. So you all have yourselves a great night. And